A lot of medicine is pretty fragmented, so for the most part people tend to sit in their silos and sort of say, you should ask your primary care doctor about that. But pediatrics and family medicine have like a different role. One of the hardest things to teach that takes a lot of time to figure out is what's the patient's agenda when they walk into your office. I think it's a good starting point to at least honor the fact that when you walk into a room, you have to earn trust. I would say maybe the most obvious example right now is around vaccines. Parents come in a very vulnerable position often in pediatrics where they'll say things like, my mom or my sister or my aunt or my friend on Facebook has said this, what do you think, doctor? There is so much misinformation online that is clouding that concept of who to trust and who not to. It takes a lot of bravery to say to a health professional, you know, I'm just not, I need a little bit more guidance and help about this, even though I know this is sort of recommended. And humility from on the end of the, I think, health professional to be able to say, this is a lot of information and it can be really overwhelming. Most people, when they're scared and overwhelmed, just need nurturing and love, which that's not like in the textbook. You have to almost create space where people feel safe and respected. It's like really important to listen, hear what people are feeling and scared of and worried about, and figure out how best you can kind of like guide people when they're ready, but not before they're ready. I think that that is one of the hardest parts about medicine, and it's not something you could read in a book. It's something that takes time and experience, and when you talk to the folks who really do listen, you can hear it, but you can't hear it if you're not listening.